point of your drill or your zygomatic implant. So what do we mean by A5, B5 and C5? A5 means it's tooth number 5, the second premolar. Okay, A5 is tooth number 5. B5 is from this junction. It is 5 mm superior mesially because we want to be as close to the zygomatic bone as possible. And what is C5? And I can give you a guarantee for this. I have done a 30 CBCT analysis that when you follow A5 and B5, your C will always be more than 5 mm away from the orbit. Actually it is more than 15 mm away, but rhyming में ABC 555 ज़्यादा अच्छा लग रहा है, तो वो better है शायद समझने के लिए. So how do we do the surgery? I mean, this is the planning what you do. So this is, I always see that this is the C junction from where your arch goes posteriorly. So from this point it is 5 mm away. So this is B5. Okay, so what we do, we take the normal first burr, we make a small osteotomy at point B, using a drill, which is your pilot drill or a pterygoid drill. Why you want this? Because the diamond burr has an extension which gets engaged into it. So the second step is you take your diamond burr and you try connect it the point B with point A. So you prepare this slot. And for me, this is my guided surgery. Why? Because now the drill is touching the parietal wall, it is touching the mesial, it is touching the distal. The diameter of diamond burr is 4.2, the diameter of the drill is 4.2, the diameter of an implant is 4.2. Even if your membrane gets ruptured, the treatment is just to place a biocompatible material into that area. So even if the membrane is ruptured, which does not get ruptured after you use a diamond burr, but even if it gets ruptured, the treatment is just to do the surgery, just to place that implant. So this is the drill, the diameter is 4.2 mm. Okay, you go into the osteotomy, you go and prepare an osteotomy into the zygomatic bone. Then this is, for me, this is the most important step to choose the right length of zygoma. So how to choose it? You first take it out of the bone and then give a palatal pressure and just see that it is always ending up in this region. So second ring, which means I have to open a 40 mm zygoma. See, every time when I am trying to pull, it is ending up here. So 40 mm, 37 mm, any zygoma I can place. Now I will place my implant here and it gets inserted. Now just see how beautifully it has sealed this area. How beautifully. Now if your membrane gets ruptured, don't try to take some PTFE or resorbable suture and try to repair the membrane because it is not required. This has sealed it completely. It is one of the most wonderfully designed kits which are available with many systems now, and it seals the area completely because the diameter of diamond burr, the diameter of drill and the diameter of zygoma remains the same. 2-3 minutes. Yes. So what happens when you shift point ABC? So when you do this with the proper positioning, you get the perfect placement of your implant where your implant ends up in premolar. If you have a doubt that you are going towards the orbit, what you do? Just move your point A easily to tooth number 4 and you see what difference it has made. It has taken the apex of the drill too posteriorly. But when you plan your point B wrongly, what happens? You can go towards the orbit, which we don't want. Okay, but unluckily, it has happened with many doctors and you see the zygomas are placed in the orbit. So to avoid complications, you should follow a technique which is known as Zaga classification. But हम लोग महाराष्ट्र में हैं, तो I will follow Maja classification, which is very simple. I don't follow Zaga classification because with this technique you cannot follow Zaga classification because we remove buccal bone always. So what is Maja classification? Simple, intrasinus, where your whole of the implant lies inside the buccal bone of the crest. Extrasinus or partial extrasinus, where half of your implant is outside and half is inside. And extramaxillary or extrasinus, where whole of your implant is lying outside the buccal bone. And then you won't end up in complications like this. Another important point, that use an implant which is made up of grade 23 titanium. You can scan the code and understand the difference between grade 4, grade 5, grade 23. And you see in Carl Misch it is written, use of stronger grade of titanium reduces the fracture by 72%. and you will not end up in situations like this where your zygomas have fractured. We have increased the diameter, okay, from 4 mm to 4.5 mm. Now which implant I am using, it has add-in implant which has a diameter of 4.5 mm, because more the diameter, less is the stress, and 1 mm increase in implant diameter reduces the stress by 96%. Which means from 4, if I am shifting to 4.5, I am reducing the stress by another 50%. So as I said, so that you don't end up like this. Hybrid surface, everyone is promoting nowadays.